Hello everyone. This time I have got questions from the TOG April 2023. I hope you'll find these questions useful, and if you haven't read the TOG articles yet, then I do recommend that you give them a good read before you answer these questions. So the next slide will have the question on it, followed by a choice of answers, and the slide following that would have the answer on it. I will pause for a few seconds in between the question and the answer, so it gives you enough time to answer it. But if you'd like more time, then do pause the video and continue it at your pace. Good luck with the questions. So question number 1 is maternal physiology changes in pregnancy. What is the increase in cardiac output? Is it A, 10%? Is it B, 20%? Is it C, 30%? Is it D, 50%? Or is it E, 40%? And the answer is it's D, 50%. Question number 2, STEMI, which is ST elevated myocardial infarction, accounts for what proportion of maternal acute coronary syndrome emergency presentations? Is it A, 45%, B, 90%, C, 75%, is it D, 70%, or is it E, 25%? And the answer is it's C, 75%. Question number 3, coronary artery spasm accounts for what percentage of acute coronary syndrome cases in pregnancy? Is it A, 5%? Is it B, 0.5%? Is it C, 1%? Is it D, 2%? Or is it E, 3%? And the answer is it's D, 2%. Question number 4, how long should pregnancy be delayed for after an acute coronary event? Is it A, 4 months? Is it B, 6 months? Is it C, 12 months? Is it D, 24 months? Or is it E, 9 months? And the answer is it's C, 12 months. What is the rate of perinatal mortality with non-immune hydrox Fatalis? Is it A, 20%, B, 30%, C, 60%, D, 80%, or E, 90%? So it's a rate of perinatal mortality with non-immune hydrox Fatalis. And the answer is it's C, 60%. What proportion of non-immune hydrox Fatalis cases present before 14 weeks of gestation? Is it A, more than a third, B, less than a third, C, less than a quarter, D, greater than 2/3, or E, less than 2/3? And the answer is it's D, more than 2/3. When is delivery recommended for patients with cardiac disease? Is it A, 36 weeks, B, 38 weeks, C, 40 weeks, D, 37 weeks, or E, 42 weeks? And the answer is it's C, 40 weeks. What is the length of time that's recommended for passive second stage to be delayed for in patients with cardiac disease? Is it A, 0.5 hours, B, 2 hours, C, 3 hours, D, 1 hour, or E, 4 hours. So what's the length of time recommended for the passive bit of the second stage to be delayed in patients with cardiac disease, so that the active stage could be shortened, is the whole idea. So your options are A, 0.5 hours is 30 minutes, B, 2 hours, C, 3 hours, D, 1 hour, or E, 4 hours. And the answer is it's B, 2 hours. What is the leading direct cause of maternal mortality? A, gastrointestinal disease, B, respiratory disease, C, cardiac disease, D, pulmonary embolism, E, hematological disease. And the answer is it's D, pulmonary embolism. For worsening non-immune hydrox Fatalis, to optimize perinatal outcome, when is delivery recommended? Is it A, 32 weeks, B, 34 weeks, C, 36 weeks, D, 38 weeks, or E, 40 weeks? And the answer is it's B, 34 weeks. What is the complication rates of uterine artery embolization for PPH? Is it A, 6 to 11%? Is it B, 6 to 10%? Is it C, 6 to 9%? Is it D, 6 to 7%? Or is it E, 6 to 8%? And the answer is it's D, 6 to 7%. What is the risk of recurrence of acute coronary syndrome in pregnancies of women with history of ischemic heart disease? Is it A, 2%, B, 9%, C, 8%, D, 5%, or is it E, 3%? So risk of recurrence of acute coronary syndrome in patients who have had previous history of ischemic heart disease. And the answer is it's B, 9%. Well, that was the last question. I hope you found these questions useful. Do give the video a thumbs up and do subscribe to my channel if you haven't already. And please leave in the comment section if you found this video useful, and also if there's any other videos that you'd like to watch, especially if this would help you to revise for your MRCOG exams. Good luck revising!